If you've been popping antacids or taking PPIs every day and you're still dealing with reflux or burning symptoms in your throat, I want to tell you something that most doctors won't tell you outright. Those medications were never designed to fix the problem, they were designed to mask it. In over 20 years of clinical practice, I've seen thousands of patients who've been on acid blocking drugs for years, actually sometimes decades, who still suffer, and the reason is always the same. Today I'm going to break down exactly what antacid and acid blockers actually do in your body, what they completely ignore, and what the research actually shows us about addressing reflux at its root cause. By the end of the video, you'll also understand why most natural supplements fall short and fail for people with chronic reflux issues, and what a truly comprehensive approach actually looks like. Hi, I'm Dr. Kevin Passero, Chief Science Officer for Durable and practicing naturopathic doctor with over 20 years of experience, and a lot of it working with people with digestive issues like GERD and reflux. Now, this video is specifically for people who've already tried something. Maybe you've tried antacids, maybe a PPI, maybe DGL, maybe apple cider vinegar or aloe extracts, and you're still not where you want to be with your symptoms. You're not imagining it. There's a reason why these approaches often fall short, and it has everything to do with how reflux actually works. I'll put a lot of this information into my book on reflux, so you can make sure to check that out as well. So first, a little safety note before we get started. If you're dealing with frequent reflux, a diagnosed GERD, a precancerous GERD-related condition, having difficulty swallowing, or you're currently on prescription medications, let's make sure to work with your healthcare provider before making any major changes, because what I'm sharing is educational, not a substitute for individualized medical care, obviously. Now, that said, understanding how these interventions work and the alternatives is something that every patient deserves to know. So let's get started. What do antacids actually do? So antacids work because there's too much acid, right? Well, not exactly. You see, antacids like calcium carbonate, magnesium hydroxide, or aluminum hydroxide chemically neutralize acid. So when you chew them up and swallow them or drink them in a drink, they bind with stomach acid and neutralize the pH, lowering the acidity of your stomach and giving you a little bit of relief, because it's that acid that's causing the burning. But as we talk about, it's not necessarily always due to too much acid. Now, they have a short mechanism of action. They tend to work for a few hours, which is why people have to habitually take them. They work quickly within about 30 minutes, but wear off relatively quickly as well. And a lot of people end up in that trap where they're constantly popping these things all throughout the day. And at that point, it's not therapeutic anymore. It's just dependency. So that's how antacids work. Now, let's talk about another more common class of medications, PPIs and H2 blockers. Let's talk about how they work and what some of the risks are. So PPIs are very interesting. They stand for proton pump inhibitors, and they irreversibly block the activity of the proton pumps in the stomach cells that are necessary for the production of acid. Proton pump inhibitors work incredibly effectively. They're about 98 to 99% effective in stopping acid production from the acid producing cells in the stomach. They only work for about 24 hours. So while they're incredibly effective, if you miss your dose the next day, as many people will tell you, the acid symptoms flare right back up again. H2 blockers are an older class of medication, and they work by blocking histamine, which is a compound that activates the acid producing cells in the stomach. So it's a little different than blocking the proton pump, which directly blocks acid production. H2 blockers work by sort of shutting down one of the cues to actually cue the stomach cells to make acid. They're not nearly as effective as PPIs, and that makes them not quite as effective for people that are experiencing problems, but it also makes them a little less side effect prone than proton pump inhibitors. Now, most people out there who have been dealing with GERD or reflux for a while are typically on PPIs, and that's what we're going to spend some time talking about. And with PPIs, the big issue with the side effects has to do with this mismatch between how these medications were actually designed and how they're used. And this is information that you often won't hear anywhere else. Over-the-counter proton pump inhibitors are FDA approved for 14 days at a time, no more than 3 times a year. Now, that sounds reasonable, but if you're somebody that's watching this video or knows somebody who suffered with acid reflux, it's very unlikely that you use it in these terms. 14 days, 2 weeks, only 3 times a year, oftentimes that leads to temporary resolution with return of symptoms and then repeated use again. Now, when they're used in a prescription setting, the FDA gives it a little bit more bandwidth. The doctors can prescribe them with guidelines up to 4 to 8 weeks for most GERD, chronic reflux issues, or ulcer issues, or other specific conditions like erosive esophagitis or precancerous lesions in the esophagus related to something called Barrett's esophagus, where long-term use is clinically appropriate when it's monitored. Now, I would argue that there's oftentimes underlying factors that aren't addressed, and giving PPIs just masks the issues and doesn't actually fix them. But the research is clear, very, very clear, that a significant portion of people on long-term PPI therapy do not fall into these categories. They started them when they got general heartburn, but nobody ever revisited whether or not they still needed it. And that's simply because doctors don't really have many other tools for managing even common heartburn than these medications. And while they effectively mask the symptoms, they don't treat the underlying cause, and like we're going to talk about, create some significant risks. Now, in this section, we're going to talk about the risks that the FDA fully recognizes. These are written risks and written warnings actually on the packaging within these medications, both the over-the-counter ones and the prescription ones. The first one that comes up that is incredibly important has to do with nutrient depletion, and this sort of trickles down into some other areas where there's warnings, because what we need is stomach acid in order to be able to absorb certain nutrients. Minerals particularly need to get ionized in the stomach in order to be prepped for absorption in the small intestine. And ionization occurs through the acid, which sort of changes that molecular charge on the mineral, ionizes it, and allows it to be absorbed in the small intestine. Without proper stomach acid, you can't ionize minerals, and the FDA knows, based on extensive studies and research, that these medications reduce stomach acid to a degree that you don't ionize your minerals and don't absorb them. And there's a few key minerals that we need to look at. Number one is magnesium, which has over thousands of roles in cellular processes throughout the body. It's one of the most abundant minerals in the body, and it's incredibly important for physiological function on a multitude of levels, including muscle contraction, which plays very real role in your heart function and your heart contractility. Now, the really interesting thing about PPIs and magnesium deficiency is that you actually can't correct the magnesium deficiency with magnesium supplementation while you're on the medication. The only way to correct the magnesium deficiency is to actually go off the medication, which puts people in a really tough spot, because if they try and go off of it and their symptoms come back, they're stuck either having horrible symptoms or having magnesium deficiency. And this is why we have to understand these underlying causes and other mechanisms to support reflux and GERD. The other major mineral that's affected from proton pump inhibitors is calcium. Now, this trickles down into bone mineral density, and we know that people who are on proton pump inhibitors long-term are much more prone for fractures and bone fractures. Now, this is a huge issue because we know so many of the people that end up on these medications are in their 40s, 50s, 60s, and 70s, which is the time of life when bone density really starts to go down, particularly in women, but also in men. So we're already getting an increased risk of bone fracture just from aging. And then we know there's clear and legitimate research that shows that use of these medications, and the longer you use them, the more you increase your risk of fracture with proton pump inhibitors because of this lack of being able to ionize and absorb calcium. It's a huge issue. We also know that there's clear warnings on kidney inflammation and kidney damage with these medications, which of course is not ideal. And we know that there's an increased risk of certain types of infections, particularly something called C. difficile infection, which is an infection in the gastrointestinal system and can cause severe diarrhea, and it's very difficult to treat. It's oftentimes antibiotic resistant or requires multiple courses of very expensive, strong antibiotics, and sometimes even after that, it's not even fully balanced out. And we know that proton pump inhibitor use increases the risk of C. difficile infection, or the likelihood of getting it, especially if you're on these medications that end up in the hospital. There's also other drug interactions with them. Probably one of the most notable ones that's on these warnings is with some of the newer blood thinners, which, listen, if you've had a heart attack or a stroke, and these newer generation blood thinners are oftentimes prescribed long-term if you've had one of those issues. So if you happen to have one of those issues and reflux, you could end up in a really dangerous situation where you're not protecting your blood system correctly with this anticoagulants because the medication is interfering with it. So those are the written warnings that are clearly stated, which anyone who took the time to read the package inserts would be able to identify, because the FDA requires that the drug makers makers put these in there. Now, the warning that isn't on the label and should be has to do with something called rebound hypersecretion or rebound acid hypersecretion. When you suppress stomach acid with proton pump inhibitors, because they're so effective, they trigger a process in your body where your body has a constant monitoring of the acidity of your stomach. It wants your stomach to be acidic for some of those reasons we just talked about. We need stomach acid to break down protein as an immune barrier and to be able to properly absorb nutrients. So this body starts to get concerned when stomach acidity gets low, and it starts to increase the release of the hormones that trigger your stomach cells to make more acid. But the drug is so effective in suppressing acid production, the body is overproducing the hormones that stimulate the acid production, but the drug is blocking the acid production from actually occurring. So what happens is when you come off of the medication, you have blood levels of hormones that are much higher than normal for the stimulation of acid secretion. So when you come off the drug, you get a surge of acid production, oftentimes way above what you were experiencing before you even went on the medication. And this is the cycle that keeps people stuck. You try to stop, you feel worse, you conclude that you need the medication, and you never want to go off of it again. And what's actually happening is physiological rebound, not confirmation that your reflux is permanent and can't be cured or can't be helped. And this risk appears nowhere on the label. Okay, a lot of consumer advocacy groups have been petitioning the FDA to include this warning because it is very real and it is clinically and research validated. It is in the medical journals as a known side effect. And it happens in a relatively short period of time. Anywhere from 3 to 4 weeks of chronic use of PPIs can result in this hyperacid rebound secretion, which causes a really bad exacerbation of symptoms. So if you're on a PPI and you want to come off of it, you really need to work with your doctor on a tapering strategy. And I outline some tapering strategies in my book, but work with your doctor. The rebound is real, but it is manageable if you have a good plan and it's done thoughtfully and thoroughly. So just to reframe it all, I mean, proton pump inhibitors do have a place for specific, well-defined conditions, like the initial stages of healing an ulcer or a very severe GI problem. However, there are significant side effects. And if you're not thinking about your off-ramp for these medications and you're just sort of signed up for taking them long-term because you just had general reflux, which they're not even intended to treat long-term, you're setting yourself up for some of these potential side effects and risks, which can significantly affect your health later in life. So in this next section, let's talk about what medications actually don't do at all. They don't do key things that support your body's ability to recover and have a normal functioning system that helps to address your reflux at the root cause. They do nothing to improve your mucosal lining or soothe irritation. Well, they do a little bit by suppressing acid, but they're not doing it in a healing way. They don't address why the acid is refluxing in the first place, and they actually don't support the integrity of the gut in general. In fact, they can actually cause problems lower on, like we talked about with other infections and incomplete protein digestion, fueling microbiome dysbiosis. So they can create actually more problems with the GI system further down the road. Now, just to retouch on some of these issues, we have this mucosal lining in our stomach and esophagus. It's a protective layer of mucus. And in chronic reflux, oftentimes that mucus layer gets compromised, and these drugs don't do anything to really help heal it. We also need to soothe the irritation and inflammation that's in the stomach or in the gastric lining. The damage is already there, and nothing in these classes of drugs are doing anything to address it. Sometimes if you calm the acid down enough, you can let the body heal, and the drugs can do that in initial stages of treating really bad ulcers, but they're not really triggering or stimulating or working with the body's healing process to relieve that irritation or inflammation. And that's where a lot of natural therapies come in and do a wonderful job. They also don't address why acid is moving up in the first place, whether that's a problem with your lower esophageal sphincter or other motility problems like slow gastric emptying or other underlying imbalances like small intestinal bacterial overgrowth or other issues. They're not doing anything to address those root causes, and they don't support the gut lining integrity. With chronic reflux and long-term acid suppression, both are associated with increased intestinal permeability, or that condition that's often referred to as leaky gut, which drives broader immune dysregulation and actually drives more body-wide inflammation and can drive more inflammation in the actual GI issue. So nobody really talks about that in the context of reflux, but it is highly relevant and something to be considered. So in this section, let's talk about why natural supplements also often fall short, because I've been alluding to why the medications fall short, but supplements, if you've tried them, oftentimes people experience that they don't fully do the job they want to do either. And there's two main problems with it. Problem one is that single ingredient formulas, which is mostly out there, only target one pathway. So for example, deglycerated licorice or DGL targets the protective barrier along the lining of the esophagus and the stomach. Aloe vera calms the inflammation. Glutamine helps the gut integrity and the gut lining. Zinc carnosine soothes and repairs the mucous membranes and actually repairs damaged tissue at the cellular level. Individually, they each do something meaningful, but they work on different parts of the problem. And if you're leaving certain pathways unaddressed, you're not going to get the full benefit and that full resolution. So it's always going to seem like these natural therapies maybe help a little bit, which a lot of patients will experience or a lot of people will experience if they try it, but they don't really give them significant, sustainable, long-lasting relief. And it's because they're not addressed simultaneously. Now, aside from there being a formula problem, the form matters as much as the formula. So here we are dealing with an issue in the esophagus, okay, and the stomach. Those are the most areas of dysfunction if we're talking about reflux conditions. Now, if we're taking our natural therapies as a pill or a tablet, capsules or tablets do not break down until they get to the stomach, and some of them not even until they get to the small intestine. Now, if the irritation and inflammation that we're experiencing with our reflux is primarily occurring in the esophagus, how is that medicine supposed to actually do its job? So it is incredibly important to use products when you're dealing with reflux, natural products that actually come in contact with the esophagus and ideally are delivered to the stomach ready to do their job. So when I formulated durable acid relief, we had to make sure that it was delivered as a powder, because powdered formulas were always what I saw work best in the clinic with my patients. And it was going to be an absolute must, because when you mix it with water and drink it, as you're swallowing, comes in direct contact with the tissue of the esophagus, the lower esophageal sphincter, and then it's delivered into the stomach, ready to go. No capsule needs to be dissolved. It's immediately available to the stomach lining and to the tissue in the stomach to do its healing properties. So those are two major reasons why natural supplements oftentimes fail. So let's talk about the multi-pathway model that you have to apply to natural supplements if you want to get good effects when it comes to reflux relief. Now, it's not just natural supplements, it's a whole framework that includes lifestyle, which we're going to go over in the next section. And then we're going to talk about what we need to do to soothe and calm irritation, what we're going to do to restore the mucosal integrity of the esophagus and the stomach, what we're going to do to protect and balance the stomach environment. And there's a couple important things we need to talk about there. And what we're going to do to promote upper digestive comfort, upper digestive motility, and GI health in general. It's those multi-pathway approaches that can lead to a long-term resolution of reflux without having to rely on medications that only mask the symptoms in the next video. But let's talk about soothing and calming inflammation. One of the first starting points is to calm the tissue down that's already inflamed, which does make a lot of sense. Now, we already talked about DGL or deglycerated licorice as a major tool to do this because it stimulates more mucus production when it comes in contact with the cells of the esophagus and the stomach. It creates sort of a protective coating along the esophagus and gastric lining that gives a little bit of a barrier to the acid to just give the tissue a little bit of a break. It's sort of like if you have a blister on your foot that keeps rubbing on a certain part of your shoe and you put a Band-Aid over it, that actually reduces the inflammation by creating a protective barrier. DGL also has some direct anti-inflammatory properties, so it helps to just settle inflammation in general, which is part of the healing process. It's one of the most well-researched botanicals for this purpose. It's not just a folk remedy that is sort of good. If you deliver it in the right doses, in the right forms, there's solid research that DGL can be an incredibly effective tool in helping to support the mucous membrane and reduce that inflammation. Now, next step or pathway 2 that I try and get people to focus on is supporting and restoring mucosal integrity, because sometimes when the inflammation is persistent enough, the mucous membranes actually get damaged and they can start to get eroded. And there's one key ingredient that most people have never heard of called zinc carnosine, which has amazing long history, decades of research out of Japan for helping to treat gastric inflammation and mucosal damage. It's not just regular zinc. It's a combination of zinc and an amino acid that has this unique property to allow it to actually stick to the damaged mucosal tissue and create this very dramatic healing effect of the cells to support tissue repair. Then we need to protect and balance the stomach environment, and this is where a lot of conversations just don't get talked about. There's two key issues we need to discuss here, and they have to do with infections. There's something called H. pylori, which many people have heard of. H. pylori is a type of bacteria that is fairly common in the population, but if it gets out of control, it really compromises the stomach's ability to protect itself from acid. It's a major cause of ulcers, but it can also be a major cause of chronic reflux and chronic GI issues. Doctors will often test for it when they're going in to do a visual examination of the esophagus and the stomach if someone's had chronic reflux through an endoscopy. But a lot of people actually don't get screened for H. pylori, and there's ways to do it. You can do stool antigen tests, which are very effective, or breath tests done at standard labs that can detect the H. pylori and help you determine if that needs to be treated. If that's there and left untreated, it doesn't really matter what medications or supplements you take, you're actually not going to get that much better. If H. pylori is present and you're treated with traditional medications like PPIs, it can actually lead to permanent destruction and damage of the cells of your stomach that make acid, leaving you set up for sort of scarred stomach tissue, which can be problematic long-term and leave you really compromised with digestion. So it's really important to get that screened for. Now, the lesser known one is something called SIBO, or small intestinal bacterial overgrowth, which is when bacteria from the large intestine migrate to the small intestine and basically set up camp. Most of our bacteria in our digestive system should be concentrated in the large intestine. So when they get to the small intestine, they cause all sorts of problems, primarily a lot of bloating and motility issues. So the gastric emptying can slow, the small intestine emptying can slow. There's lots of gas produced, particularly methane and hydrogen, which can cause a lot of bloating. And all that bloating and slow motility ends up becoming a pressure problem. And it basically creates a lot of intra-abdominal pressure, which puts a lot of stress on that lower esophageal sphincter at the bottom of the esophagus and allows the acid to get pushed up into the esophagus where it doesn't belong, causing lots of acid reflux symptoms. So if you have acid reflux and you've tried a lot of things and it's still not working, these are two key things that you need to get screened for that are root cause issues that if not addressed, it's going to be very difficult to progress in your healing of this condition. And then we want to promote just the health of the GI system in general. We want to look at things that support gastric emptying. We want to try and identify motility issues. We want to make sure we're chewing our food properly. We want to make sure that the GI system is properly supported from the top all the way down to the bottom, because like we've talked about before, or if you've never heard this, even constipation or slow lower bowel motility can result in that decreased motility in the upper GI, also causing that intra-abdominal pressure and creating a higher risk of reflux issues. So let's dig into the lifestyle picture and reframe this section a little bit, because here's something I've learned from 2 decades of clinical practice. You can take the best formulated supplements in the world, but if you're sitting on top of a lifestyle that's constantly pouring fuel on the fire, you're going to keep fighting an uphill battle and you're never going to get full resolution of your symptoms. So while the supplements are incredibly important, lifestyle always has to be a fundamental part of really healing at a deep level. So I'm not just going to give you a generic list of things to avoid and things to eat. I want to explain to you why some of these things can be problematic, because a lot of times these conversations do not happen. Most people think that trigger foods are a problem because of their increased acid amount, and that is true. Some foods like tomato sauces or really citrusy foods, they do have a lot of acid, and anybody who's had reflux issues or even just mild heartburn issues can attest to the fact that those are definitely trigger foods. If you're already irritated and you put more acid into the system, you're going to make that irritation even worse. However, there are a lot of foods that can exacerbate symptoms, not because of their acidity, but because they actually weaken the tone of that lower esophageal sphincter. These are things like coffee, alcohol, chocolate, High-fat meals create very slow stomach emptying and make that lower esophageal sphincter relax. And peppermint all have this relaxing effect on the LES, which then kind of leaves that opening for acid to touch the esophagus, which is what causes the burning pain and the reflux symptoms in general. So sometimes it's actually not the acid that's causing the problem, it's the effect on the lower esophageal sphincter and the valve that's really affecting the issue. So that's very important to understand. Also, when it comes to foods, the one thing that is never talked about, but is probably the most important issue, in my opinion, has to do with food sensitivities. So gluten and dairy products in particular are big drivers in inflammation and permeability within the gut for susceptible individuals. When the gut lining is compromised, reflux is almost always a part of the picture. And these food sensitivities are not straight food allergies. They don't cause hives or rashes or things that people generally associate with food allergies. They're delayed hypersensitivity reactions that trigger low-grade inflammation. And that inflammation just basically creates a state of dysfunction in the esophagus and the stomach that leads to ongoing symptoms of reflux. Getting these food sensitivities identified and eliminated has been one of the most powerful tools I have used with thousands of patients to help them overcome their chronic reflux problems. So if you think this might be an issue for you, do your own research, get screened, or do some experimentation with your diet, because it's oftentimes a major piece of the puzzle. Now, there's some other very important aspects when it comes to lifestyle related to reflux. Meal timing and meal size plays a big role in the pressure problem. So reflux isn't always just a chemistry problem, it's also sometimes a problem of physics. A full stomach can create a lot of intra-abdominal pressure, and if we eat really large meals, especially high-fat meals that slow stomach emptying, and then we lay down and go to bed, we're basically taking gravity out of the equation. We're laying down flat with an overfull stomach, and that really puts a lot of pressure on that lower esophageal sphincter and becomes sort of this physics problem more than this chemical problem. Eating too quickly is also a major underrated issue when it comes to triggering reflux. So when you eat too quickly, number one, you don't chew your food enough, and mastication and chewing your food is part of pre-breaking it down before it gets to the stomach. And if that food isn't broken down properly, the stomach doesn't empty quite as quickly, and you get that increased lower esophageal pressure. Now, in addition, eating quickly allows you to swallow a lot of air, which causes some bloating, and it just creates other issues that don't allow the stomach and the system to properly move through. So slowing down, chewing your food properly can really help to relieve some of your reflux symptoms. And like we talked about before, just not eating too late either, because our digestive function does tend to slow down a little bit later in the day, at least for a lot of people. Our digestive energy tends to be a little bit higher in the middle of the day than it does at night. So eating the same meal at different times of day may be a big trigger, even regardless of the laying down factor. And the general rule of thumb with laying down is to wait at least 3 hours from when we ate to when we lay down. And that's a good general practice for longevity and health overall, to have had anything to eat. It really helps kind of extend that fasting window and activate a few other really healthy benefits of intermittent fasting that have really nothing to do with GERD, but a lot to do with just healthy aging in general. Now, chronic stress is another major issue because stress hormones have some significant impacts directly on our gut. They directly influence acid secretion, and they also directly influence the ability of our body to produce that protective mucus that protects us from the acid. High stress hormones also slow our stomach emptying. So we end up possibly with more acid, less protective mechanism, and slower digestion, which creates more pressure on that LES. So it's like 3 independent factors that can really create a lot of problems. So just to have a practical note, even some of these very simple interventions that don't seem all that complicated, slowing down before meals, not eating while working or super stressed out, taking a few minutes to do some deep breathing before you eat to activate your parasympathetic nervous system, which is responsible for supporting digestion, can have a measurable effect on your digestion and your nervous system in general. These aren't soft suggestions if you're dealing with chronic reflux. They change the physiological environment of your digestive tract in real time and are major building building blocks to overcoming chronic reflux issues, especially when you're looking to take a totally natural approach. Now, we already talked about the gut infections, and if we miss those, it's very difficult to end up with good resolution. So make sure if you're dealing with chronic ongoing reflux that isn't responding to medications, natural supplements, or anything that your doctor is doing, to make sure that you get screened for H. pylori and SIBO. So if you've done everything, diet, stress, and a well-formulated supplement, and you're still not getting where you want, these are really important things to look at. So here's how to think about it clinically, and what I want anything watching this video to walk away with. Lasting relief from acid reflux requires three things to work together. You have to address the inputs, so that's your lifestyle, right? And the food that you're eating, and some of these things we discussed. You have to address the underlying imbalances, so that's getting proper workup and diagnosis for things like H. pylori and SIBO. You have to give the tissue what it needs to heal, and you have to address all of those inputs together in order to get success. And most people have only ever done one of those three things, if any of them. Some people maybe have done two, and that is oftentimes why people don't get the lasting relief. When all three of those things are in place, people come back and say that they get the lasting relief that they're looking for. So it's important to look at the entire framework throughout all of the different factors to get a really good resolution. So if you've made it this far, I want you to sit with something for a moment. You've probably been dealing with reflux for a while, and you've tried a lot of different things and started to wonder if it's just something you have to live with. But it's not. The reason why something hasn't fully worked isn't because your case is unusually difficult or because you haven't found the right antacid or over-the-counter medication. It's because every approach you've tried was probably only addressing a part of the problem and not all of them together at the same time. And that's not your fault. It's really a gap in how reflux is explained and treated to the average person. And that's both in the conventional world when we're looking at just masking the symptoms, and also in the natural health space when people really are just trying to sell you something that may or may not work. And that gap, filling that gap, is exactly what I've spent the better part of my career trying to do and trying to close with patients, is creating these comprehensive structures where people can get the relief that they're actually looking for. And while supplements do play a part of that, also lifestyle does as well. So we've talked a lot about the multi-pathway model, and I haven't really gone deep into the formula I've actually built around this framework with the specific ingredients, the doses, and the research behind each one. See, that's the next video, and I want to be straightforward to you about why I think it's really worth your time. There's a significant difference between a supplement that contains an ingredient and a supplement that contains the ingredient in the right form, at the right dose, delivered in the right way, and combined with the other synergistic ingredients necessary for it to actually do its job. Most products in this category of reflux fall short in at least one of those areas, and I'll show you exactly how to evaluate reflux supplements, including mine, so you can make your own judgment for yourself and try something, hopefully, even if it's not ours, that will work for you. The goal here is not just to sell you something. The goal is to give you enough understanding that you stop guessing and start making decisions that actually move the needle on your condition and empower you to take control of your health and take control of a condition that clearly you've been very frustrated with. So reflux is one of the most common conditions I see in practice, and it is one of the most unnecessarily persistent. When the right pieces are in place, the results can be significant and they can happen faster than most people will expect. So if this video is giving you a good framework you didn't have before, please share it. Please watch it again, forward it to someone who's been sick and dealing with the issue, and stay tuned because I'll see you in the next one.